So today we're going to be doing, I'm going to teach y'all the difference between parallel and perpendicular for taking full mouth series, okay?
Okay.
So I need some volunteers, so I'm going to draw your names, okay? First, Nikki, Bree, Haley, and Alicia. Let's go. So for parallel, oh my God. Okay, so first we're going to do parallel. And the definition in the book, parallel means moving or lying in the same plane, always separated by the same distance and not intersecting. So, Nikki, Alicia, I want y'all two to lay on the ground just like you would parallel, and I'll tell you if it's right. Okay, perfect. So yes, you guys made a perfect parallel line. I love it. Okay. Okay, y'all did great. Now we're going to do perpendicular. So perpendicular means intersecting or forming at a right angle. So that's going to look like this with a right angle in it, okay? So now I want y'all to show me what you think a perpendicular line would look like, okay?
Okay.
Oh, I love it so far. Oh, perfect! Okay. Y'all get extra credit, 7 points on your test, and that's it. So today we're going to...
Hey guys, it's me, Morgan. Today we're going to be assembling some XCPs, and up first we're going to have Anna show us how to assemble the blue XCP.
Hello guys, so we're going to do the interior one, and we're going to start off with our bite block, and the sensor's going to go right here. We're going to get our metal piece and attach it to the right side, and then we're going to get our ring and attach it, and make sure you can see your bite block through the hole, and that's it for the interior.
Action.
Hey guys, it's Morgan again. So I'm going to be showing you how to assemble the the yellow XCP. So you're going to take your bite block again, and you're going to take your metal bar and you're going to insert it into the right side for the maxillary right premolar and molar images, as well as the lower left side premolar and molar images. And you'll attach your ring, and you want to make sure you can see your bite block through it. So then when you move on to your left maxillary premolar and molar images, you're going to want to flip where the bar is, and you want to make sure to take off your ring and replace it to make sure that the bite block is still within the ring. And you'll do your maxillary left side and your lower right.
Action.
Hi guys, it's Randy. So I'm going to show you how to put together a bite block or a bite XCP. Bite wing XCP. So we're going to take our bar and we're going to position it to where the sensor will go is this way, and the bar is going to go away from that. It's going to be on the right side. Then you're going to take your ring and position it as so, and you'll be able to see clearly through that ring. And you're going to take 4 images. They will take the interproximal areas of the maxillary and mandibular teeth at the same time. And yeah, that's it.
All right, action.
Hi guys, Jackie here. So the blue FMX is used for the upper and lower canine to canine. So it gets crown and root. The yellow is used for posterior. It's for premolars and molars, premolar and molars, premolar and molars. And then the red is used for the bite wings, and it's 4 images, premolar and molar, premolar and molar, and it just gets the crowns.
Okay.
Hey guys, so we're going to be learning the sequence for a full mouth series FMX, and we're also going to show you the backward C.
Okay, first you're going to start with your anterior periapicals. So you're going to start with maxillary. The first one is going to be your lateral and your canine. This next one is going to be your 2 centrals. The next one is the left lateral and canine. You're going to drop down to your mandibular, still on the left side. You're going to do your lateral and canine. Then you're going to move to your centrals, and then on the left, you're going to do your canine lateral. I'm going too fast.
Okay, then you're going to move on to your posterior PAs, and since we're already on the right side, we're going to grab that XCP and start on our premolar, molar. We're going to use the same XCP, go down to your premolar, molar, on your left side. Now you're going to switch your XCP around and you're going to do your premolar, molar. You don't have to switch your XCP. Then you're going to do your premolar, molar. Now we're going to talk about your bite wings. Your bite wings are going to get your maxillary and mandibular. So you're going to start with your right side and do your premolars, then go back to your molars, then you're going to go over to your left side and do your premolars and the molars. And always in your FMX series, you want to remember your backwards seat.
I'm lining up to the central beam.
This is the central beam.
Then here we have the long axis of the tooth. It's the longest part of the tooth.
Hey guys, it's Miss Jenkins. Today we're going to learn about the paralleling technique. We got Katie here that's going to do a voiceover as I demonstrate this for you.
Alright, step number 1. The receptor is placed in the mouth parallel to the long axis of the tooth being radiographed.
Excellent. So the long axis of the tooth, which is this is tooth number 11, which in our sequence is number 3 that we take. The long axis of the tooth splits the tooth in half. It's easiest to see that between the cusp and the gingiva. So we're going to place the receptor in the patient's mouth. If you'll turn towards me, we're going to set this up. Have the patient open really wide, and then you'll have your patient bite down right there. As you can see, that is according to Katie's directions. Okay, point open. She's going to read the next step for us.
Step number 2. The central ray of the X-ray beam is directed perpendicular at a right angle to the receptor and the long axis of the tooth.
Excellent. So I'm going to have you turn towards me. Excellent. Open really wide.
Hey guys, it's Randy. So I'm going to show you how to put together a bite block or a
Bite
bite
together for me. Beautiful. And open. Just bite right there. Excellent.
tomorrow, and we're going to position it to where
Open.
the sensor will go is this way, and the bars will go away
Bite right there.
from there.
Yes.
On the right side.
Turn towards me. Perfect. And then tilt your chin down for me.
So
Per Katie's directions, this is how that would look.
you're going to take 4 images.
Because this beam, the central beam, is now perpendicular to the long axis of the tooth.
At the same time.
You can open. Next on Katie's list, she's going to tell us.
Step number 3. A beam alignment device must be used to keep the receptor parallel with the long axis of the tooth. The patient cannot hold the receptor in this manner.
That is what your XCP is for. It is set up in the correct position to know that your sensor is placed in the center of this ring, like so. If you had it like this, that would be what we call a butthole mistake. So where you see your sensor is not in the center of the ring. Next, what is on Katie's list? That is all of the instructions for the paralleling technique. If you have any questions, review this video or let me know, send me an email.
So today we're going to be showing you the advantages and disadvantages of paralleling technique. I'm your dental assistant today, and we're just going to take a few x-rays.
Okay. The primary advantage of the paralleling technique is that it produces an image without dimensional distortion. In addition, it is uncomplicated and can be easily repeated when serial images are indicated. Accuracy. The paralleling technique produces an image that has dimensional accuracy. Simplicity. The paralleling technique is simple and easy to learn and use. Duplication. The paralleling technique is easy to standardize and can be accurately duplicated or repeated when serial images are indicated. As a result, comparison of serial images exposed using the paralleling technique have a great validity.
Can you open up?
Is that going to hurt?
It may be a little bit of discomfort, but not too bad.
Okay.
Bite down.
Ow, that hurts.
And unfortunately, this is one of our disadvantages. It causes patient discomfort.
The primary disadvantage of the paralleling technique is receptor placement. Receptor placement causes difficulties and it may cause slight amounts of pain.